Heart disease remains the leading cause of U.S. maternal deaths, particularly affecting Hispanic women. American Heart Association volunteer expert Dr. Johanna Contreras joins us now to share new research on how pregnancy can affect cardiovascular health, as well as share some tips on reducing the risks. So thank you so much for joining us, Doctor. Such an important topic, of course. So tell us more about this new research on cardiovascular health and pregnancy.
But what we have found is that there have been a significant increase in cardiovascular mortality in pregnant ladies, in pregnant women. So what we have found is Hispanic women and women of color tend to have a higher incidence of hypertension, 40% more likely to have prediabetes, and unhealthy weight. And we know that all these conditions can increase the risk of cardiovascular mortality and cardiovascular complications during pregnancy and after pregnancy.
Okay, then let's talk about some of the risk factors for maternal heart disease and stroke.
So it's very important that any woman that wants to get pregnant consider to have a prenatal visit, because what we have found is many times these factors, like the unhealthy weight, the diabetes, and the hypertension, can be present before the woman gets pregnant. If we can control the risk factor before pregnancy, we can prevent the complication of the risk factors. For example, diabetes. If you can control the diabetes, get the diabetes under control, get into a healthy way, when you get pregnant, you can prevent to get the gestational diabetes and obviously all the complications of diabetes, not only for the woman, but also for the baby. High blood pressure is very important. Pregnancy is a very high stress state for a woman for a woman, and having gestational hypertension can develop preeclampsia, eclampsia, all the way to seizures, and all the way that the woman can lose the baby. So it's very important that if somebody have high blood pressure, that blood pressure get controlled before pregnancy. There are specific medicines that have to be used if the woman wants to get pregnant, because there are medicines that can produce side effects in the baby. So it's very important that the woman can control that, because a lot of the mortality that happens during pregnancy and during the after pregnancy, like bleeding, stroke, infarcts, and cardiomyopathy, can be prevented if we can control these risk factors. So it's very important. You want to have a healthy life and a healthy lifestyle. The best recommendation is our Essential 8. Have a healthy weight, exercise at least 5 times a week for 30 minutes, have a low cholesterol diet, control your sugar, sleep well. We know that sleeping is very important. 8 hours of sleep is very important for any patient, or really for a woman that is pregnant. It's very important that she can get to rest, or really avoid smoking, stress situations, avoid so much stress, or really being pregnant is stressful. Control your blood pressure and monitor the blood pressure. So it's very important, some healthy lifestyle modifications that you can do before pregnancy and obviously during the pregnancy and after pregnancy too.
Right. Okay, so then what are some of the ways that cardiovascular disease specifically affects Hispanic women?
So we know that Hispanic women and patients have to have a high incidence. We know there are genetic factors to have high blood pressure, and it's very important that if you and your family have history that in your family member there is high blood pressure and diabetes, you're more likely going to develop this, and you probably develop this early in life. So it's very important to know your risk factors, your family risk factors. Many times our Hispanic patients don't have any idea. I mean, a lot of us have immigrated to this country, so we don't have any idea about our family health. And it's very important that we talk to our family and see what are the conditions that run into our family, because they're more likely running ourselves and early in life. With the change in diet and healthy lifestyle, obviously you're going to have more risk factors. So it's very important to that. Prediabetes, we know, for example, Mexican Americans and Hispanics for Latin America have more incidence of prediabetes, and obviously prediabetes more likely to develop diabetes, and especially during pregnancy. Many important for Hispanic patients too is many times a lot of my pregnant women have never seen a doctor. So they really don't have any prenatal visits to prevent these complications. And many times I wish I had seen them before they go pregnant, because many of these things I can take care of those things before the pregnancy. So a lot of these things that we're seeing is a lot of times Hispanic patients are presenting to the doctor after pregnancy or during the pregnancy with no prior healthy visit, with no prior prevention visit. So it's important. A lot of risk factors that are involved in the increasing incidence of this disease in Hispanic women, but we know that also, independent of the genetics, also the lack of access to healthcare, the lack of education, the lack of preventive medicine is very important. That's why we want to create this awareness campaign to make sure that people understand this and actually can take action to improve their health.
Okay, well, let's give the folks some resources. Where can we go for more information?
They can go to our website, gorreforwomen.org/pregnancy or gorreforwomen.org/embarazo. Y lo quieren in Spanish or in English, so you can have both in the website.
Okay, wonderful. Well, thank you so much, Doctor, for joining us today and talking about this important topic. I think this could help a lot of people out there. And you at home, if you'd like to see this interview again, you know you can head to First Coast News Plus.